Namaste, welcome to Misan Health. Today we are here with Dr. Ramakrishna Aradhyula garu from Gentleas Pharma Private Limited. Hello sir, how are you?
Fine.
Sir, in previous episodes we discussed about curcumin, how it works on arthritis. Today we are going to discuss about sciatica, how it works on sciatica persons.
See, last episodes we discussed about curcumin. Curcumin is a product which works powerfully in rheumatoid arthritis, arthritis, ankylosing spondylitis, and different types of pains. This is a wonderful product. In fact, curcumin is made up of curcumin, a substance which is extracted from turmeric.
Okay.
Normally, turmeric contains 5% of curcumin, but whereas in curcumin tablets, we are giving 95% curcumin.
How it is possible? Sir?
We are extracting it and we are
Okay.
standardizing it to 95% and we are giving it in a tablet form.
Okay.
That means, see, for example, if you want 1 kilo of this particular curcumin powder, we have to put 20 kilos of turmeric root. Then we get 5 kilos powder of this particular curcumin. I mean, for 1 kilo of curcumin. So that is the power of that particular product. Anyway, since you asked the question about the sciatica, sciatica is a pain which normally originates from the buttocks and it travels through the leg, each leg.
Okay.
Normally the pain is originated through this particular sciatic nerve.
Okay.
Sciatic nerve originates from this particular vertebral column from buttocks to the each leg. And in fact, it is a combination of 5 nerves which travels down to the legs. See, this particular pain radiates and it is severe pain.
Okay.
See, normally this pain is due to several reasons, but you can focus depending upon what you call, apart from the environmental.
What is the main reason?
That is environmental pollution and the foods what we take and obesity, weight. Apart from this particular pain occurs due to the herniated disc between the vertebral column.
Okay.
Each vertebrae and vertebrae to vertebrae, there is a particular cushion bone which normally gives you flexibility to the spine. Okay. Is called cartilage. Of course, that particular disc, we call it as disc. This particular disc, if it is herniated, means it is disturbed. This particular disturbed or the nucleus comes out of that particular disc and which causes a little type of pressure on this particular nerve roots, sciatic nerve roots.
Okay.
This is one reason. Second reason is because of this particular compression of the bones. In case of the heavy weight people, this and the limited movement of the spine and all these things results in this particular compression may give certain bony projections which we call the extra growth of the bone. This particular extra growth of bone or this particular part of the bone may create some pressure on this particular roots of this particular sciatic nerve. This is the main reason why the sciatic pain occurs.
Okay.
And this particular, let it be any pain, let it be any sciatica, definitely it is going to give you a severe pain which attacks often and even night times also. This is a painful condition where it spells on the quality of life.
In which age group
See, normally, nowadays it is surprised, though the medical textbook says that it is about 45 years, but nowadays 30, 25 years people also getting this particular problem because of the early aging, lifestyle, and the foods what they are taking.
Okay.
See, sciatica can be divided into two. One is the true sciatica. The other one is sciatica-like infections or symptoms. See, the main symptoms are pain and inflammation and numbness of the leg. That means the leg loses a little bit touch and sensation.
Okay.
These are the general symptoms. The problem is, since it's a compression of the nerves, this particular nerves may control this particular bladder and it leads to incontinence. That means the nerve system or nerves on the bladder will lose its control and people may go for this particular incontinence. Incontinence means irregular or irrespective periods without their control, the urination.
Okay.
You can imagine how discomfort it is. And second thing is fecal incontinence. That means they will not have control over the motions. So this particular sciatica may result in this particular disease. So definitely you require a product which works on these multiple targets. See, normally the medicines which is from chemical origin, or today we call it as allopathy or English medicines, they are uni-targeted. They may control only one particular part or one particular indication or one particular mediator of the pain. See, normally, whereas this curcumin is multi-targeted. It takes care all the conditions which is responsible for this particular sciatic pain. This is, see, I told you the reason for the sciatic pain, but during this particular process of this compression, there is one particular factor which gets activated is TLS alpha, tumor necrosis factor alpha. This is responsible, or this is the root cause for this particular neuroinflammation, nervous inflammation. And second thing is, there is no control over the androgens. That is the reason these bony growths will come. When you control this particular androgen, this thing, automatically you can control this particular bony projections or bony growth also. That particular part will be taken care by one particular ingredient which we are adding in curcumin. Curcumin contains curcumin 95% and a particular factor which controls this particular androgen part is tulsi or holy basil. Tulsi, holy basil. And here I told you the challenge is, number one challenge is I have to give full dose of curcumin which is required to control all these conditions is 1000 milligrams. And whatever curcumin I give, it got to absorb completely to the blood. And second thing is the power got to be enhanced. When you want this particular action which controls this TNF alpha and this particular androgen, it assists the androgen levels. These two factors required a minute penetration of this particular curcumin to the body. For that, you require to amplify it. For amplification, what we are doing is we are just subjecting it to the nanotechnology, and we are making this particular curcumin into nano part. That means 1/1000th of the part. And second thing is, we are adding amplifiers to this particular curcumin. Number one amplifier, I told you already, I discussed about this, it is ginger. We are extracting gingerol from this particular ginger, and ginger incidentally belongs to the same family of curcumin. So it amplifies the action of curcumin. Second thing is galangol. Galangol is also a powerful product which is having equal effects of curcumin and belongs to the same family of curcumin. We extract galangin, it's a very, very important part. We added in this to amplify the power. And moreover, an excellent product and adaptogen called tulsi or holy basil. This enhances the total action of that. And tulsi is an adaptogen. Whatever body requires, it meets that requirement. That is the beauty of this particular tulsi. This is the product, and definitely it works for these conditions. But as far as this particular incontinence of urinary and fecal matters are concerned, yeah, definitely if it is in advanced stage, people have to go for surgery. But before that, you can try this curcumin and you may get relief in a month. There is no doubt about that. For example, if it is herniated disc, the duration of treatment may be weeks and months. But in case of incontinence, you may get result. You may feel the interval, or you may, a urination to urination time gap, if it is maintained, that means this product is working. You have to use it prolongedly.
And there are many doubts regarding these Ayurvedic medicines. When it comes to English medicines, people will close their eyes, they'll use it. But when it comes to Ayurvedic medicines, they'll think about it. Is it good or not? Is there any side effects like that?
Harika, you are telling in reverse. English medicines, you have to use it cautiously. Because in every English medicine literature, they give the side effects, probable drug interactions. You have to take, and every drug will have its own side effect. But whereas Ayurvedic product, they don't give you any side effects. Why? Because they are from food sources. See, turmeric is a daily part of your life. In every meal, you are taking turmeric. The only thing is, it is curcumin removed turmeric. That is the reason you are not getting the desired action. But you require curcumin 1000 mg. That we are giving it in the tablets of curcumin. So safely you can use, and the beautiful combination. There is no question of side effects at all.
And how to use it?
2 tablets you have to take at a time. Better to remember that bedtime, 2 tablets, you take the 2 tablets.
After dinner?
After dinner, when you are sleeping, you take 2 tablets to have a nice sleep. Because tulsi has got very good effect, it induces good sleep also. I mean, unperturbed sleep, what I mean to say is. And definitely this is going to be very good product for sciatica.
And how many days it will take to cure this?
That depends upon the condition. See, for example, I told you, if it is herniated disc case, it works for weeks to months. But whereas in case of incontinent sciatica, the pain will disappear immediately. But this control, it takes little time.
This is absolutely a wonderful product. And if people needs this product, how to approach you, sir?
Yeah, this definitely a precious product, and it is more than a gold standard. If at all people want to have or to try this product, kindly call this particular number which is displayed under my name. You can call this number, our telecallers will answer you and they will deliver this product to your doorsteps.
You have given wonderful information, sir. Thank you.
Thank you very much.